hemisphere collateral pathway. The second type of collateral could be posterior to anterior via the posterior communicating arteries. So let me erase these. Posterior to anterior would be flow going through the posterior communicating arteries from the back of the brain on both sides, from both vertebrals, towards the front, taking the posterior communicating arteries. Right, so we're going from the vertebral, the basilar, through the posterior communicating arteries to either the internal, if needed, the middle cerebral, or the anterior cerebral arteries. That would be posterior to anterior collateral circulation. Erase this without erasing everything. And then the external to internal branches, again, that would be in the neck. Any of those collateral branches, the external can then compensate for an occluded ICA via the external branches. So that's your basic network, again, of the circle of Willis, remembering that only 50% of the population has a complete circle of Willis. That means 50% does not. If they don't have a complete circle of Willis and there is an obstruction, usually they're going to be symptomatic. And again, it would be some of those symptoms we talked about. Anterior circulation would be things like paralysis, blurred vision, difficulty with speech. Posterior ischemic events would have symptoms related to the cerebellum not getting enough blood, unsteady gait, walking like they're kind of drunk or tipsy, drop attacks where their legs just kind of give out from under them without losing consciousness. So those would be signs of back brain ischemic events. Any questions?